Okay, your time starts now.
Hello, my name is Dr. Shoaib. I am one of the doctor today in this facility. Am I talking to Mr. Asim, 27 years of age?
Yes, doctor.
Nice to meet you, Mr. Asim.
Thank you, doctor.
Can you tell me about your health condition?
Doctor, I'm really very sick nowadays. I had a problem with my tummy and I was passing too much stools and on and off, I'm sick. So I went to GP. GP gave me some
Okay.
medicine, but it didn't help me a lot.
Okay.
He referred me to your consultant. He did my scans and he gave me some medicines. But
Yeah.
unfortunately, this medicine is not helping at all. Please, doctor, tell me what's going on with me and what my reports are today.
Yeah. I appreciate the knowledge about your health condition, and I can see that you are worried about your health condition. So, can you tell me, do you have any expectation or any idea about today meeting?
Doctor, is this something wrong in my tummy? There's
Mm-hmm.
something is bad. I think because I'm suffering too much. 4 months now, almost.
Yes, I'm here to help you and support you in this regard. So as you told that you are having these health issues and tummy problem, and so the test we make for you, the blood test and the scans of your tummy, all of these tests, the results came, and the good news it is normal.
How could be, doctor? How could be a good news that all normal? Then what's going on with me? Why I have these problems? Do you think I'm a
Mm,
mad? I'm making this all problem by myself.
No, 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 not at all. I'm not thinking at all like this. So be assured that I will help you in this regard. The symptoms you are suffering from, I can see that you are upset. You are regarding your health condition, and I will help you. Okay. Can you tell me that how is there any pain now you are feeling?
Of course, doctor, there is a pain. That's why I'm here. I
Yeah.
think, doctor, I think you need to do more scans. You need to do a scan of this MRI or CT scan, which I have heard and I've seen in the internet.
Oh, yeah. So currently, I appreciate your concern, and I will tell you that we have done all the workup and all the scans which were needed in your condition, and all of them are normal.
Then what's going on with me, doctor?
Yes, I can tell you. Can I try for you a little bit so that it may help you in understand this condition?
But doctor, what's going on? How can you draw without any problem? Do you have any idea what's going on with me? I think
Yes.
you need more workup. I think you need more workup, doctor.
Yes, in this condition, we call this as a IBS. Have you heard about this term before?
No, doctor, what is this? This is
It's
something
basically
serious?
it is called IBS is irritable bowel syndrome. Like in the gut, this is functional disorder rather than or any related with the body parts. It's there is no problem in the body parts, but it is the problem in the function. Are you with me?
Yes, doctor, I'm with you. Do you think that I have something in my head?
Sometimes what happens that there can be oversensitivity to certain stimuli. It can be some stress, it can be some anxiety, it can be some trauma. You do you copy?
No, doctor, I don't have such symptoms. I don't have any
Uh-huh.
stress at home. I don't have any trauma. But what's going on with me? And why did your doctor gave me some medicine? I have read on the internet. These medicine usually used by the mad people. Do you think I'm a mad? I have some brain problem.
No, 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 not at all. I am not thinking like that, and be assured. I want to assure you that all the information you provide to me, it will be remain confidential. Okay, so that it will help me better in to address you and to deal with your condition. Is it okay with you?
Doctor, is okay with me, but can you tell me what's going on? Why you are hesitating to do more tests? Because I'm afraid maybe I have a cancer in my tummy.
Yes, I appreciate your concern, and we have done the test, and we have figured out your problem. Let me explain to you.
Please, doctor, do something. Explain me what's going on.
Yes, so in this problem, we call it that as the oversensitivity of certain stimuli, and your brain is interpreting is as a health condition, but in reality, it's not any health condition. Are you getting me?
Doctor, I'm getting you, but then what happened next if my brain is not perceiving? What is the
So,
connection between gut and brain, doctor?
so the information we are processing in our brain, it is connected with our gut. And in this case, when we perceive some stimuli and some information, and our brain is interpreting it as abnormal, and it is interpreting as a health condition, but in reality, it's not like that.
Okay, doctor, I
And
understand now. I think you better to do something, some scan of my brain then.
yes, we have done all the necessary blood test and scan which were needed in your condition, and there is no more need for any other test now. Are you getting me?
Yes, doctor, I'm getting you, but you don't want to understand me. I'm suffering. I'm suffering for last 4 months. I was thinking someone will help me, but
Yes,
again, so what you are going to do now with me?
we are here to help you. We will make a team of doctors, and we will involve our mood doctors also in this case. And but don't worry that it's not for every people like you are thinking. Okay, so sometimes they give medicine, sometimes they give only talking sessions, and it will be helpful for you. Is there any other information you want to share with me?
But doctor, I don't understand why you are involving now mood doctor.
Yes, I appreciate your concern. As I told you, that sometimes they use medicines, and sometimes they do talking sessions and some graded sessions and mood sessions. This will help you in understanding your stressors or anything in the past, what happened, and then in this condition, you will feel better, I'm sure.
2 minutes left.
Is there any concern in your or any query in your mind?
Doctor, actually, my grandmother having had cancer of tummy. I'm afraid that I might have this cancer also. Can you be sure that there is nothing wrong with my tummy? I don't have such condition.
I appreciate your concern. Till now, the blood test, and scans which we have made so far, all are negative. And but keep in mind that we will keep you in our follow up, and we will keep you under our observation. If you develop any new symptoms, please let us know. We will drop our number, and we will drop our contact information. Okay, so that we will follow you. Is it okay with you?
Doctor, it's okay, but I'm too much worried about that. The next month, my university trip is going to other country.
Okay.
Will I be able to travel with them? Because I want too much to go with them.
Yes, for sure. You can travel with them. There is no problem. But before that, I want you to see this team of doctors, and they might help you before you travel. Is it okay with you?
You are going to prescribe some medicine, and you have give some exercises. If I will follow these exercises, will I be able to travel with them?
Yes, if you don't develop any new symptoms, yes, for sure, and your health condition is good. It will depends on that time, and I will be able to answer this question after I will see you in the next visit. Is it okay with you?
Okay, doctor. Okay.
Is there any query in your mind?
A lot of queries, doctor, but I will follow your recommendations and we will see how that will help me.
Okay, I will drop
Time
you
up,
some leaflets about this
time up,
condition, and
time up.
thank you.
Sorry for being a rude with you, Dr. Shoaib, but you did very well. You didn't agree with the surrogate to have some more test scans, and you explained the condition. But surrogate was a little bit irritated because of his symptoms, and he was wanting some help. Actually, there are few jargons in your performance. Symptoms, you use the word, and there are few concerns which need to be addressed in other ways, like I have a cancer. You didn't ask there why you think you have a cancer. Is there anything specific which is bothering you? And regarding the traveling,
Mm.
yes, you can travel. We cannot say anything uh, because it's very early to say. We will see how your condition will respond. Then we will let you know if you can or not. Okay, it's very early to say. So,
Okay.
what was the category of this scenario actually?
So it's to explain the functional condition basically.
Yes. Okay. If anyone from the doctors, if want to add something uh, related to Dr. Shoaib's performance today, otherwise I will start to explain how to approach this category. Anyone want to add something? Okay. Uh, Functional neurological disorder nowadays are coming very frequently in PACES exam. They have in different scenarios nowadays, like irritable bowel syndrome, sometimes fibromyalgias, sometimes the surrogate is unable to move her legs or head legs, and and sometimes there are headaches. Despite all investigation has been done, there is nothing wrong with the scans or labs, and so patient is waiting you in a hall and need to discuss with him. So it's always very difficult to have a such condition, especially in exam. There are a lot of stress there, and you are there. So how to approach this category? First of all, when you are outside, just your first task is to recognize what is the category of this scenario which you have in your hands. So once it's a functional disorders, so you should make a plan how you're going to deal with this tough surrogate. So when you enter, then hello, my name is Dr. Azhar. I'm one of the doctor today in this facility. Am I talking with Mr. Akram or Aslam? How are you today? So Dr. Sheb, your agenda was missing actually. So
Yeah,
need to fix an agenda. So we are
agenda.
here to discuss about your health condition. Is that okay with you? Take a permission and expectations. What do you think? Uh, what's your expectation from today's meeting? So he will tell you the stories. So I'm suffering, nobody's caring about me. I'm a rolling stone, some is throwing here and there. Just give sympathy and empathy and then disclose the condition in a such way that he will not immediately be irritated. So you can say, we have done this, your scans, and we have figured out the cause of your problem. You can't say your scans are normal immediately. If you say immediately scans are normal, you are, throwing a petrol on a fire. So
Oh,
deal with that. We have done your scans and we have figured out the cause of your problem. The first sentence must be like this.
okay.
And you have a condition which is known as functional, which is affecting the functioning of your brain. Then
Okay.
connecting your sentences. The good thing is that we have done scan. The scans are normal. It shows that you don't have any structural problem in your brain or any part of the body. Okay.
Okay.
So you have a problem that affecting the function of your brain, and we called it irritable bowel syndrome, functional neurological disorder, whatever the scenario is there. Have you ever heard about that? take a consent here. Of course, he will say, no, I don't know about that. So do you think he will give you something? Do you think I'm a mad? I'm making these symptoms, something in my head. No, 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 Mr. Akram, it is not like that. It's a real condition. Just be with the patient. Okay. It's a real condition. And let me explain you how it is affecting your life. Okay. This is a point where when you will take over the situation. This is
Okay.
called oversensitivity of the certain stimuli like stress, anxiety, or any traumatic life events leading to your body interpreting as a tummy pain or sickness or like this. Okay, it's a real condition,
Okay.
and we are here to help you and support you. Then immediately ask if anything in your case. Just give a question. Don't be a judgmental. Then give only, ask any trigger, any possibility in your case. Okay,
Hmm.
maybe here surrogate will open up with you. Maybe he will may cite said there is some problem, home social problem, or some financial problem, whatever. So don't worry about that, Mr. Ali. We have a very good management plan for you. Would you like me to explain to you? Take a permission. Yes, doctor, please help me. Or you are going to admit me? No, no, no. Let me explain to you. Okay, this we have a team of doctors, including a doctor, mood doctor, nurse, and there are few therapies which will help you to relieve your symptoms. And especially one thing I forgot to mention, when you have disclosed this diagnosis, immediately need to draw, which you were about to draw, but I interrupted there and you distracted and you forgot to draw even. When you condition explain the condition, it's a functional condition, IBS. Let me draw for you. Just draw a simple gut, brain, make a arrow connection, some hormones, some protein are releasing from the brain, and here is the muscle in the gut. So it are affecting the function of the muscles of the gut. So sometime it getting contractions and sometime relaxation. That's why you are having these problems. Now coming to the point again, treatment plan. So team of doctors, mood doctor, nurse, relaxation therapy, coping strategies, pacing and grid exercises. You have to mention, no need to explain in detail because surrogate only want to listen this. You have any idea about that or not? Then social sports. Why psychiatrist? Why mood doctor? Do you think I'm a mad? It's not the case, Mr. Akram. Sometimes we need to help. We are taking the help from the mood doctor. It is not always that he is going to treat with some medicine. He will sit with you and give you a plan of management. Sometimes it is helpful for most of the patients. Okay, they don't need even medicines. The concern was here, uh, do I have a cancer? So always ask, whenever surrogate is asking something, do something like do a CT scan, do a brain scan, give me that medicine, give me this test, I want to do this, I want to do this. Just ask, take a pause, just gently, humbly. Why you need, why do you need this test? Is there anything specific which is bothering you? Then his concern was travel. Don't say yes, you can travel. It's not up to you. It's up to the patient's response to the treatment. Always
Okay.
don't give any limits, any time scale in PACES exam, especially in communications and consultations. When I don't know, it depends upon the results and your progress to the treatment. Because our role is senior house officer or house officer, we are not going to manage anything. We are not going to prescribe any test. We are not going to prescribe any medicine. We are here, our task is to discuss. You got it, Dr. Shoaib? Now,
Yes, yes.
is there any question from anyone about this scenario? Dr. Shoaib, so whenever you have this scenario in your exam, please take a deep breath, and before disclosing that you don't have anything and the scans are normal, just
Mhm.
give a warning shot, a good news in that sense that we have figured out your problem. We have identified, okay, we
Okay.
sorted out what is going on with you. This is a real problem. I understand your worries. It's very difficult. It is very hard to have such condition, but don't worry about that. We are here to help you and support you. Okay. You did very well. Safety netting you done at the end. You give a brochure, leaflets, and if there is a new symptoms, you can contact us and we will investigate you further. If you are thinking that there is something sinister in your tummy like cancer because you have a strong family history, so at the moment you have nothing like this. We are very sure about that. So if there is a new thing, then we will see in the next visit. Okay.
Yes, yes, yes.
Okay. Dr. Sadman, are you there?